Everyone, we've got another heart today. This is number 942 in our collection. The heart would have sat roughly in the chest like this, anterior surface towards the screen, posterior surface towards the turntable, head or superior here, legs or inferior here, left and then right. Let's go ahead and do what we always do, which is start off by trying to identify, at least externally, what appears to be the right atrial appendage. And here we find an appendage that's triangular, broad-based and pyramidal in shape. So let's go ahead and open up the atrium here. And as soon as we do that, we see that there in fact are pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. We see that the atrial septum is intact, the oval fossa is intact, there is no defect here. Here is the mouth of the coronary sinus. Here is the tendon of Totaro. And anytime we see the coronary sinus and the mouth of the coronary sinus and the tendon of Totaro, we also want to find the right-sided atrioventricular junction. And the triangle formed by the coronary sinus, or its mouth, and the tendon of Totaro, and the right-sided atrioventricular junction. At its apex is where we expect to find the atrioventricular node. So here's the triangle of Koch, and at its node, at its apex is the AV node. And then we also have the superior caval vein still attached to this heart as well. And here is where the superior caval vein drains into this heart. And you can see the superior caval vein here. When we turn our attention to the right-sided atrioventricular junction, there's 3 leaflets. This valve does have direct connections to the ventricular septum, consistent with the morphologic tricuspid valve. The ventricle here does have coarse trabeculations. There is a septomarginal trabeculation, aka a moderator band, with its cranial and caudal limbs, all consistent with the morphologic right ventricle. When we get into the right ventricular outflow tract here, we do come across our first arterial valve or semilunar valve. This does have 3 leaflets, 1, 2, 3, with 3 sinuses, 1, 2, 3. There appear to be no coronaries arising from within these sinuses. And this valve is completely supported by muscle, all consistent with the morphologic pulmonary valve. It's important to point out that the arterial valves do not have a round or oval annulus. The half-circle fibrous valvar leaflets do have these triangles of myocardium imposed into them, meaning that this crown shape is actually the true annulus. The round or oval annulus or basal ring that we create clinically, while helpful, is not a true anatomic structure. And here is the pulmonary trunk, which has been transected. Here's the posterior aspect of the heart. Here is the left atrial appendage. When we open up this atrium here, we do find an atrium that's smooth-walled with an intact atrial septum, all consistent with the morphologic left atrium. And then here is that left atrial appendage again. All the pectinate muscles are confined within the appendage itself. And here is the mouth of the left atrial appendage in the left atrium. When we look at the left-sided atrioventricular junction, we do find that there is a 2-leaflet atrioventricular valve without any direct connections to the ventricular septum, all consistent with a morphologic mitral valve. There does seem to be some EFE in this valve. The valve itself does appear to be properly formed and of adequate size. This ventricle here does have fine crisscross trabeculations consistent with the morphologic left ventricle. It does appear to be a little hypertrophied. And then we get into the left ventricular outflow tract. We do come across another arterial valve here, aka semilunar valve, although we see that this valve is very abnormal compared to the previous semilunar valve that we found. This is in fact the aortic valve. We can see that it's thickened, rolled, quite dysplastic. It does have some fibrous continuity with the mitral valve, but you'll see that in its supporting structures, this actually does appear to have a round or oval-shaped annulus. We don't actually see interleaflet triangles here, so certainly abnormal architecture of this aortic valve. And when we look at it, you'll kind of see this keyhole opening here, consistent with a unileaflet or unicuspid aortic valve. And these leaflets, these components of the single leaflet would have been connected. They have been cut apart here, but you can see how this is a single leaflet with this kind of keyhole opening that is pretty distinct by echo here. And you can see how this would produce some clinical stenosis during life. So let me try to get this closer so you guys can see this. But here is that unileaflet aortic valve, and you can see that kind of keyhole opening, which is fairly small. And we could easily imagine how this would produce some degree of stenosis. We can try to look at it from the top as well, and look down into the sinuses. And here we go. Here is that opening from the top, and you can see within the sinuses as well. And we can see there are some coronaries arising from within these sinuses, all consistent with the morphologic aortic valve. So here we've got an aortic valve that is stenotic and is unicuspid or unileaflet. There is some endocardial fibroelastosis again. And here we see the ascending aorta, which seems to be of good size, the transverse aorta, which also seems of good size, and the descending aorta. So a nice specimen with a unicuspid or unileaflet aortic valve.